Good morning, Elin. Good morning, YouTube. We have a really big day today. We are heading down to Stanmore Orthopaedic Hospital for Elin's pre-op appointment. And it is now 10 to 7, so we've got 2 hours just about before we have to be on our way. Madam's fed up with waiting for me. She's been awake for quite some time. I put some music on so that I could go and have a shower, because this morning a shower wasn't optional. It was necessary. Okay, så. Okej, är du beredd, Elin? Upp. Oh, I've had breakfast. Elin is having breakfast and I've got her medicines all prepared here. And that she needs to have, and ideally at a fairly calm pace. We like a fairly calm pace of medicines in the morning. Yeah, we do, don't we? Yes, we do, don't we? I have both my bullet journal and Elin's medical journal with me today, because there's obviously organising me, which for the time being, my journal for today says Elin pre-op at Stanmore. Between 7 and 8 it's shower, breakfast, dress, pack, that kind of stuff, and then it says leave at 9 exclamation mark. And I have double checked on the map. It says 52 minute. It says a 52 minute drive at the moment, so we should be fine, giving ourselves an hour and a half to get down there. Obviously we're driving in the WAV, so we need to take it a bit easy. So that's kind of what I've done for my journal. For Elin's journal, I have written that I need to remember to bring food and syringes, her baclofen and her rescue medications. The baclofen is a muscle relaxant and she has to dose at lunchtime. And then her epilepsy rescue medications I need to bring with me, and she's got 2 of those. I need to bring nappies, wipes and spare outfit. And I need to obviously bring her water pump and her suction. Cheers. And then I have a few notes here of things I want to remember to talk about, and I just remembered a final one. Okay, so I have 5 bullet points here. I want to talk about Elin's seizures and how they might affect her in operations, and how they are planning on keeping an eye on her. I want to talk about her reaction to general anaesthesia. I want to talk about blended diet, because Elin's going to be staying in hospital for a long time, and she doesn't do very well on formula. I want to see what we can do to work together to support a blended diet while she's in there. And then I also want to talk about post-op pain management. Elin has an incredibly high pain threshold, but in her last hip operation she actually went into pain trauma post-op, and that is something I really want to avoid. So I would rather we over-medicate for pain management. And then the final thing is COVID protocol and parent stays. Elin's going to be in hospital for a long time after this operation. So are we allowed to swap over, or is it one parent the whole time? So those are the notes I've made that I need to remember to talk about. I have not packed or prepared anything. I'm not ready. Elin's not ready. It is 5 minutes to 8. So we have got an hour before we need to get into the car. So I should probably finish my coffee and get cracking. Oh, excuse me. It's already been a very long day. Yeah, so we've been to the hospital and we've come back. Host. And we're quite tired, and I think Elin is a little fed up with just sitting in her chair now. But we have done Elin's pre-op assessment at Stanmore Hospital. We've met an anaesthesiologist and we have met a paediatric surgical nurse. And we've talked through a lot of things. Oh my god, a lot of things. I made, as I mentioned earlier in the video, I made a note of 5 things that I wanted to make sure that we covered off today, and we covered off all of them, so that was really good. So we talked about Elin's seizures and how we treat them, and that of course led us to talk about Elin's really excessive vomiting and how we deal with that. So we have actually put in place now that we're just going to put an NG tube in, just in case we need to keep draining her stomach of excess stomach acid. We're just going to put it in and it's there. We are going to probably have, at the very least, a phone conversation with the dietitian before Elin goes in for operation. Hopefully at that point Elin will have a Mickey button and not a G-tube peg. And I'm going to explain all of that in another video, which I'm hopefully going to record today as well. But at the moment Elin still has a peg, but hopefully she will have had that peg replaced by a Mickey button before she actually goes in for hip surgery. So we have also said that the hip surgery isn't like that hysterically urgent. We don't need to stress her in. As a matter of fact, it would be probably quite good if we waited a few months. And the reason why we need that Mickey button before the hip surgery is, without it, they will not support a blended diet in hospital. And Elin, she doesn't respond well to formula. This is why she's on a blended diet, even with a peg, is because we could never get her to tolerate formula. Now, when it comes to this, it's quite common for children like Elin that their stomach kind of goes to sleep, but it stops doing a thing for a bit. It doesn't really want to play. And Elin definitely does this. After surgery, she's like, no, not having anything. She can't be on just IV fluids for too long. She needs to actually get proper nourishment into her. So there is something called TPN, which stands for total parenteral nutrition, which is a different kind of IV drip that contains all the nutrition that she needs and not just fluids. And if TPN is needed, then they need to put in what's called a central line. A central line is a cannula that goes into the neck. And again, it's like, okay, what do we do? Because a central line is quite easy to put in when a child is under general anaesthetics. It's not so easy to put in when they're awake. So I'm kind of leaning towards this idea of putting in a central line, as in, let's have it and not need it, than need it and not be able to get it, if you see what I mean. But I need to discuss this with Dad, because this is not my decision alone. We also talked about seizures during operation, and during surgery they will be monitoring heart rate and see if it spikes for any reason that is outside of surgical procedure, in which case they will suspect that it's seizures. They will have an EEG trace on, but the EEG trace is there to make sure that she's actually unconscious. And Elin's seizures don't show up on EEGs. But they also give midazolam as routine during surgery. And she mentioned another drug which I don't know what it is, but it also has an anticonvulsant property. Right, so Elin and general anaesthetics, and that is probably going to be a whole separate video because this will be too long if I go into that. And I've promised you a video on her GA reactions, but Elin doesn't cope with GAs. They are going to give her something called clonidine, which is a strong calming medication, so that when she wakes up from the general anaesthetic, she's pretty much asleep. We had that in her last surgery and it made a huge difference. And then we talked about post-op pain management, and this was really interesting. And one of you, lovely lot, has actually mentioned this to me before, but I have to admit, I wasn't sure if this was something that was done in the UK or not. They're going to give Elin an epidural. So while she's asleep, they're going to put the epidural in, and they can apparently keep that epidural running for up to 5 days. So as part of pain management, they can keep the whole of her lower body numb. And I think it's brilliant. Yes, there are risks to epidurals, but there are risks to general anaesthetics, and there are enormous risks to orthopaedic surgery. Do we want a child in pain trauma? No, thank you, not ever again. I've had that. It wasn't a good experience. So she is highly likely to be having an epidural for post-op pain management, and if she does, she'll have a catheter in, because an epidural means that you don't really feel that you need to go. COVID protocol with a child in hospital. They have a one-parent policy. One parent has to stay with Elin while she's in there. And that parent and Elin must do COVID tests. And they must do the proper tests, not the rapid antigen tests. But we're going to get a call from their COVID team to discuss this beforehand. So we have to do that test 72 hours before the operation, and it is probably going to be me staying in hospital with Elin, at least if it is one of these longer term one parent policies, because I cope better with hospital stays and I cope better with sleep deprivation. I'm not sure I'm the one who copes better with having a child in surgery and sitting like this, waiting for recovery to call, but you know, that comes with it. So anyway, let's say that for sake of argument, let's pretend it's going to be me. Elin and I need to do COVID tests 72 hours before the operation, and then we need to isolate. It's going to be a very long hospital stay. And then we took a lot of bloods, like a lot of bloods. You got your plaster still? There's the plaster. Yeah, she did extremely well with the blood test. She flinched, as in she reacted. We knew that she could feel it, but there was no screaming. She wasn't upset. She wasn't bothered. We got a lot of blood from her. So they've done yet another liver function. They've checked her blood clotting. And that was actually part of the conversation about how difficult she is to cannulate, and the fact that she bled. She needed a blood transfusion in her last hip surgery because she wasn't stitched up properly and she lost a lot of blood that way. So they're checking blood clotting as well. I think there was like 7 or 8 tubes of blood in the end that they took, and MRSA swabs as well. And now we are home, and Mummy wants some food and Elin wants some music, and we want to chill out for a bit. Thank you very much for watching this update on Elin's pre-op assessment. If you are not yet a subscriber and you want to follow along the operation and recovery, then please hit the subscribe button. And as always, share this on your social media channels if you think of anybody who could benefit from knowing all of this kind of stuff. And it's really nice having you along with us on your journey. So we'll talk again soon. Bye!